Hello, hello, and welcome to the Dr. Toomer Talk Show. I'm Dr. Catherine Toomer. I am your host for this evening and every evening. Well, not every evening, but every Tuesday evening at 6 p.m. And so, welcome. Thank you for joining me. Please let me know where you're listening from. Tell me your name, and well, I'll see your name, and then tell me where you're listening, or you can put hashtag replay if you're listening later and still tell me where you're listening from. And for those of you who are tuning in for the first time, I am Dr. Catherine Toomer. I am a family medicine and community health physician. I am also the founder of Total Weight Care Institute and the host of this show. And you can find me on most social media as at Dr. Toomer, except on TikTok where I am at Dr. Toomer Talks. And that's how the name of the show came about. But I'm also the founder of a new physician weight group. It's a wellness and weight care group that is staffed by all physicians, and we're taking patients soon. We're going to be a national uh, group, and so for all those patients who I've been trying to help and been told, wait, hold off, I've got someone for you. I do have physicians. And for those who are waiting for a physician, particularly in Virginia, I do have someone for you. So um, I haven't forgotten you. You'll be getting emails soon announcing who the doctors are, where they are, how you can contact them, and get started back on the very safe and very effective GLP-1 medications that you were on before. And so tonight, I wanted to talk a little bit about menopause. I've been here getting a lot of questions about menopause, and also from men in private. Unfortunately, I don't get a lot of questions from men here, but I do get some about menopause. Now, menopause is not widely used as a descriptor, but what it really is that all people, as we get older, we start losing certain hormones. In women, we call it menopause. For some of us, in men, we call menopause because their testosterone levels start to drop. It is those hormones that make us who we are and makes us feel like we are ourselves. And often when those hormones start to drop, like estrogen in women and testosterone in men, then we start feeling a little off. Interestingly, testosterone in women drops also. And in fact, we as women have more testosterone in our system than estrogen, believe it or not. Although estrogen, we just have more estrogen than men, and we have less testosterone than men. And so estrogen sort of assigned to women and testosterone to men. So what is menopause and menopause? In women, it is when the our estrogen drops and our testosterone drops and our progesterone drops. In men, it is when your testosterone drops and other things become unopposed. In men, as testosterone drops, your estrogen becomes unopposed. And when our estrogen drops, our cortisol becomes unopposed. The result is exactly the same. We start to notice weight gain because in both cases, the drop in our what are considered our sex hormones causes a metabolic reaction that then lends itself to easy weight gain, particularly through the middle. That's metabolic weight gain. And this is the reason why GLP-1 medications, metabolic medications, work so well to counter that in both men and women. But there are 5 ways of protecting yourself from menopause or menopause. And the number one way to protect yourself is psychologically. So often we act as though menopause is the end of the world, that getting older, having our hormones drop is just the most terrible thing. We're told that it's pathologic, we're told that it means something's wrong with us, and therefore we often, are scared of it, avoid it, or see it as something terrible. So the number one protection against menopause is simply seeing it as something that's natural that you can do something about to reduce the symptoms of menopause and menopause, but it doesn't mean there's something wrong with you. And so the best way of protecting yourself again is just simply saying that, this is a normal passage of life. And in doing so, you're more likely then to not let it affect you adversely and to do something about it and something about your symptoms. And so that's really what brings me to my next point is getting evaluated for those symptoms. In women and men both, it is unexpected weight gain. Like I said, weight gain through the middle. That's usually the first thing we notice when we start going into our we start having changes from our lowering hormones. And so the best thing to do is to get checked. Now, it is very easy to check testosterone levels, both free and total, in men. And it is also relatively easy to check estrogen levels in women. However, in men, the testosterone levels that drop that cause symptoms are very easy to find. For those of us who are in perimenopause, leading up to menopause, who are then symptomatic, often our hormone levels don't reflect that. We feel the symptoms before the tests show it. And so it is often important then to diagnose menopause or perimenopause based on history, based on the information that patients give you or information that you tell your doctor. It is not based on blood tests. And many, many times people ask for blood tests when really it's their own story that tells us the answer, unless they're really abnormal. Now, of course, if you test somebody and their estrogen levels are zero, we know the answer. But if they're normal, that still doesn't tell us anything, especially if you're giving a history that suggests menopause is happening. And so I always say, treat the person, not their numbers. And this is especially important in perimenopausal women. And so when you go to your doctor and you say you're not feeling quite right, you think that you are in perimenopause, if you're over the age of 39, if you're over 40, then very likely if you're having symptoms, that's exactly what it is. Um, and when you have those symptoms and you feel that they are related to menopause or menopause, it's very easy just simply to replace the hormone. In men, you give testosterone, and depending on the levels, you give anywhere from 200 to 400 milligrams a month until they're up to normal, and then you can pause for a little while and then you repeat. And for women, you give estrogen or estradiol. You can do that vaginally, or you can do it topically, or you can do it orally. If you're having symptoms of menopause, taking medication is the only way to counter those symptoms, and that is meaning taking a pill or using a cream. If you have a uterus, it's important then to also take progesterone because it sets you up for endometrial cancer. That's the lining of your uterus. You can get cancer in the lining of your uterus, and if you take estrogen replacement without countering it with progesterone, then you can develop. So it's always important to take both. Now, when I mention cancer and hormones, first people say is, oh my gosh, what about breast cancer? The incidences of breast cancer for taking estrogen is not higher. However, if you have a family history and you're genetically predisposed for certain types of breast cancer, then yes, taking hormones is something that you want to get checked beforehand, and you want to make sure you know your family history. And then make sure that you have, annual or even biannual mammograms, meaning mammograms twice a year. Um, and and you speak to your doctor about it. This is a question of benefit versus risk, because when your hormone levels are low, both in men and women, testosterone in men and estrogen in women, it puts you at higher risk for cardiovascular disease. It puts you at risk for early dementia. It puts you at risk. When I say cardiovascular disease, what I mean is heart attacks. So using hormones protects you. It protects you against dementia. It protects your end organs, particularly your heart. In women, especially because what happens when our estrogen drops, our cortisol levels are unopposed. Now, I have talked a lot about cortisol and what cortisol does to the body. You don't want cortisol being unopposed if you don't have to. And so using hormone replacement helps counter that. The third way to protect yourself, like I said, there's not really a protection because honestly, this is a natural occurrence in life and it is something that happens naturally and normally, and we should just accept it. But there are ways to mitigate some of the symptoms and to make sure that we don't have anything that's going to harm us. So, number three is muscle. Maximizing our muscle development as early as possible will help offset the metabolic changes that occur during menopause and menopause. When you build muscle early, it also helps strengthen your bones. One of the biggest issues we have later as our hormone levels start to drop is bone demineralization, meaning that our bones get weak. And so when we fall, if we're at a fall risk, which many people are as we get older, then you're also at risk of breaking a hip. We know in medicine that once someone breaks their hip, there's a high mortality rate within the 6 months after a hip fracture. And so preventing hip fractures is really important. So as we start going through menopause, it's important then to one, get your muscle mass up as much as you can. And then two, make sure that you're nutritionally sound. So like taking a prenatal vitamin that's higher in calcium to protect your bones. And then three, check your bones. Get a DEXA scan to see where you are and whether you need to take something to help shore up your bones so that you don't have demineralization and then osteopenia, which is the precursor to osteoporosis, which means you end up losing, some of the minerals of calcium from your bones, and they break easily. So again, you see how this is all connected. And so the fourth to protect yourself is with medication if necessary, and that's hormone replacement. For men, you replace the testosterone, like I said, up to 400 milligrams a month, injected, or it can be topical. They also have testosterone creams. And for women, it is with oral replacement of estrogen and progesterone. If you have a uterus, you don't need the progesterone. If you don't, however, progesterone does tend to help with some of the secondary symptoms like sleep disruption and some of the night sweats that you see. So even if you don't have a uterus to protect, progesterone can still be helpful. And then vaginal estrogen and progesterone also to help maintain the epithelial lining, the lining of the vagina. And the reason that's so important is because as the epithelial lining thins, it puts women at risk for urinary tract infections, which are not benign. If a urinary tract infection is left untreated, especially if you're asymptomatic, meaning you don't notice that you're having symptoms, you don't even notice, and so you have this infection, it can cause infection of your kidney. And once it causes infection of your kidney, you can get what's called urosepsis. Urosepsis is fatal. It can be fatal. It's not always fatal, but it can be, especially if you have a antibiotic resistant bacteria that's causing the infection. And when I say urosepsis, what that means is you get bacteria going into the bladder, then bacteria going from the bladder into the kidneys, and then bacteria going from the kidneys into the blood. As you can imagine, having bacteria in your blood is very, very dangerous. And so maintaining the epithelial lining of your vagina is very important. And the best way to do that is with vaginal hormones or hormones of any type, of particularly vaginal hormones. So they're inserted, and what happens is that it maintains the thickness of the lining of the vagina. And so two things happen. It reduces the risk of bladder infections and it maintains sexual pleasure. It is the thinness of epithelial lining that causes pain during intercourse for women after menopause. And so that's something to take into consideration. That's an important part of a relationship. It's an important part of marriages. And therefore, using vaginal estrogen at least and progesterone at least is one way of maintaining that. And then, and it's not absorbed, it just stays locally. And then, using systemic estrogen and progesterone to counter the symptoms of menopause. And the fifth is mindfulness. Um, and the reason I say mindfulness is because metabolic the metabolic reaction to the lowering of our hormones is what often causes issues within menopause and menopause. And so, you know, doing yoga, Pilates, meditation, um, and that also goes along with the acceptance. Um, those are all things that you can do to help counter the cortisol that occurs with the dropping of of our hormones, and it also has to do with just feeling overall better. Because really, like I said right from the beginning, the best way to protect yourself from menopause and menopause is to not let it bother you, and to understand this is a natural progression of life, and that there are ways to counter the symptoms of menopause and menopause, but mainly it is to accept it and to understand that this is a natural part of life, and that there's nothing wrong with you. And it doesn't mean you're old. It doesn't mean you're broken. It just simply means that there's certain things that you need to do in order to maintain your quality of life. Hello, Sandra. Thank you for joining. Good evening to you. And again, so if you're listening in for the first time, I'm Dr. Catherine Toomer, and I'm a family medicine and community health physician and the host of this show, the Dr. Toomer Talk Show, but also the founder of Total Weight Care Institute. I'm the founder of Your Light Wellness and Weight Care Physician Group. And you'll be hearing more about that. It's exciting times because we're going to have a way for people to get help throughout the country by physicians who have access to the best of the compounded GLP-1s and branded GLP-1s at a discounted rate, as well as other wellness products. And you'll be hearing more about that later. So if you have any questions, now's the time to ask. And again, let me know where you're listening from. And then if you're listening later, say hashtag replay and let me know where you're listening then from there. So if we don't have any questions today, I'm not sure if there's some disconnection. Usually by now I have a series of questions coming in. I haven't looked at my phone. Um, so so maybe hopefully our connection was maintained in all the places. Yeah, they were maintained. So if you have questions, now's a good time to ask them. Otherwise, I'll let you go early, and I'll see you next Tuesday at 6 p.m. For the Dr. Toomer Talk Show then. So any questions at all? I guess I kind of questioned you out after the last 2 weeks of Q&As. Um, I usually get a lot of questions um, after each session, but last week and the week before, I didn't get very many just because we all asked them here. So Todd said, good evening. What are your thoughts regarding biote pellets? I am not a huge fan of using things that are unnecessary outside of the FDA approved ways of treating. And the reason is um, the only time that I kind of feel that compounded and unregulated medications are useful is only if they save the patient money and they can't get access any other way. When it comes to pellets, they're often highly expensive, way more expensive than the brand name medications or the FDA approved medication. And so my opinion and my preference is just to use what's available, what's cheaper, what we know works, and what is regulated. And what we know is actually what they say it is because it's FDA regulated. As soon as you get outside the FDA, really, it's hit or miss. And my feeling is, why take that risk when you can just get something that's good and useful and effective and not expensive and prescribed by people who absolutely know what they're doing. There are a lot of people who prescribe pellets who are not in the field that where this is part of their wheelhouse. So that's my opinion. That's my thoughts on that. And personally, as a woman who is menopausal, um, I go the normal. I just use the FDA route because I don't have to go outside of that because there's no reason to. We know what it does. We have it studied, and it's safe. Quantum says, "Hi, Dr. Toomer. What if you are already suffering from painful sex and thinning of the vagina? Can the estrogen help and do it? And what are cancer risks?" Okay, there's absolutely no cancer risk because it's not absorbed. It stays only in your vagina. You don't get vaginal cancer from hormones. And if you're already having painful sex and thinning of the vagina, it absolutely works. Yes, you can. It works. Um, and so there are again, it's estrogen and progesterone, and they inserted, and it's every single day. I think the progesterone is every day for 2 weeks, and then twice a week, and then the estrogen is every single day, and it does replace the thickness of the lining of the vagina, and sex becomes less painful. In fact, it stops being painful altogether. Hello, No Average Girl. Love your name. From Warrior, Alabama. Oh my gosh, what a perfect combination. No Average Girl from Warrior, Alabama. All right. I love that. So, Kwan, I hope that answers your question. Yes, it works. Um, this is what I recommend, and I'm going to put this in the chart again. I mean, in the comments again. Dr. Rachel Rubin, who is a urologist on Instagram and YouTube, is the doctor to follow to get good information on what you can do. And it is, I think it's at Rachel Rubin on Instagram and YouTube. It's Dr. Rachel Rubin. And she has a lot of information. She's also a sexual health specialist, one of the few fellowship trained in the country. So she's a good person to go and find her videos. Okay. Um, Sharon says, "I've been diagnosed with osteoporosis, but I cannot handle the Fosamax because it makes me feel what are other remedies there be?" Now, there are other medications. Almost all of the medications have very specific ways that you have to take them. Like you can't lie down after taking it. You have to sit upright. You have to not eat for 30 minutes in different ones. But there are other medications. There's some that even now they're coming out with more infusion ones. The best people to talk to for this would be rheumatologists, and then orthopedic surgeons. But I would start with rheumatologists because they're usually the ones who have the infusion centers, and they're the ones who often are the ones who treat the osteoporosis and osteopenia often more effectively. But don't, of course, if it's a orthopedic surgeon who's good, they're good. But I would start with a rheumatologist and ask them about other treatments and other options. Okay, so Quanta said, "What is a good cream for vaginal dryness?" Actually, the best cream for vaginal dryness is estrogen cream. Just using topical estrogen. So I would talk to your gynecologist first. I would, do some research and talk to your gynecologist and kill two birds with one stone. Use estrogen cream as a lubricant. That's one way of doing. Vaginal dryness only matters because epithelial lining is thin. So thicken the lining by using the actual treatment that does that. No Average Girl said, "What is the best way to message you about compounds?" The best way to message me about compounds is to either go to my website, drtoomer.com, and leave me a message there. It comes right to me as an email, or you can just email me at help@drtoomer.com, and that's drtoomer.com. Okay, so basically how it's written in it, like right there. That's how you should spell it. And it's help@drtoomer.com, and you can message me there. Tanya says, "Thank you for your transparency and response. The pellets have worked wonders for me." And that's wonder. I mean, my thing is this. I'm never one to tell someone not to do what works for them. If it works for you, that means you've got a good you're on good product and is being prescribed for you by someone who is ethical and understands the benefit. Just understand that if you start noticing that the benefit changes, it's probably no fault of the person who's prescribing it, but the person who's making it. Because often when you make it outside of FDA approved facilities, quality can change uh, easily. So just pay attention to that. And if it works for you and you don't mind paying the extra for it, by all means, please just continue. Um, Kwana asked, Dr. Toomer, my doctor prescribed estradiol vaginally inserts 10 meg, but I was scared to take it because of the fear of cancer. Oh, please don't be scared. First of all, the only connection between cancer and estrogen is breast cancer, and even that is rare. It's rare. It's been overhyped as being a cause, and it's very few types of cancer that are caused or even exacerbated by estrogen. So imagine that it just simply doesn't absorb beyond the vagina. It stays topical. It's only the cells of the vagina. You cannot get cancer from vaginal inserts of estradiol. Please, it is a game changer. I'm just telling, it is an absolute game changer, and it takes a little while for it to start working, at least 3 weeks, and then you start noticing a difference. But it's continuous use that makes the difference, and as soon as you stop, the benefit of it reverses. Okay, so it's, especially if you're having painful intercourse, you cannot go through the rest of your life having pain like that, and the only way to stop it is with vaginal hormones. Um, so please don't be afraid. Don't be afraid. Please listen to Rachel Rubin. She explains it very well. She has really good anecdotes. I'm not as good at it as she is, but essentially it can't be absorbed. It's the reason why if you have vaginal estrogen, it doesn't affect your partner any, because it can't get absorbed through the skin. It just stays topical and it only affects the lining of the uterus. I mean, sorry, lining of the vagina. So don't be afraid. And just know, we are not in the habit of trying to put you at risk. And so one of the things I talk about is biopsychosocial. Biology, you can't be healthy. The only way to be healthy is if you pay attention to the biology, the psychology, and the sociology. So when it comes to hormone replacement, we know that biologically the drop in the hormones causes issue. In men, it causes erectile dysfunction. They have difficulty either obtaining erections or maintaining erections. In women, we lose the epithelial lining. It thins and becomes very fragile, and therefore very painful. Intercourse becomes very painful. It also puts us at risk, like I said earlier, of urinary tract infections, which then can become kidney infections, which then can become a blood infection. It can be very dangerous. You want to avoid getting urinary tract infections. They are not benign. We kind of have this thing like, oh, it's just a UTI. It is never just a UTI. Bacteria where it shouldn't be is never just anything other than dangerous. And so, um, when we use ways of avoiding this, it's very important, and it's one of the reasons that, like I said, we're not in the habit of just trying to put you at cancer risk just for the sake of it. And in this case, you're not at risk at all. Okay, I hope that answers your question, and I hope it puts your fears at ease, because it will change your life. I mean, I'm just saying, like I said, you have to have biological health, psychological health, and social health. You can be taking hormones makes you biologically safe. It also changes how you feel, so you're psychologically improved, and then you're able to enjoy sexual activity again, which is social. So you gain all your health back across the board. And so Lindy Lou says estradiol has really helped stop my UTIs. It absolutely does. It thickens the lining the actual area, the anatomical area that prevents bacteria from getting into the bladder. Because there's only a little itty bitty tube between the outside of our bladder and the inside of our bladder, and the outside of our bladder is appropriately filled with bacteria. It's supposed to be. And so, but it's not supposed to be in our bladder. So that little tube, when it starts to thin, it also starts to shrink, and it makes it easier for bacteria to get into our bladder. We don't want that. Kwana says, thank you so much, for really appreciate you taking the time to answer my question. This has reassured me that the medication is safe, and I'm going to start taking the medication. I'm glad. I mean, honestly, that is why I do what I do. And like I said, watch Rachel Rubin's, Dr. Rachel Rubin on Instagram and YouTube. She really has some really good videos, and she explains it way better than I do. In fact, she's who I learned it from. The importance of it. I've always known it, but the importance and the significance is really because of her. So I would listen. Any other questions for this evening? Or comments or topics that you'd like me to cover next time? Because I really don't mind. So if you don't have any more questions now and you think of some later, again, I'm just going to put my email. It's help@drtoomer.com. You can email me there with questions and comments. You can also send me messages, comments on whatever video you want on YouTube. I do read those and I answer them. Anyone of you who have written me questions or comments know that I do respond. And then if you're on Facebook, I also have a Facebook group where you can join. And I'll put that in here, /groups/total. Now remember, as soon as I, disconnect, all these are gone. So kind of copy and paste them if you need them now. Okay. So you can join my group, ask me questions there. You can send me emails, ask me questions there, and topic suggestions. And then you can also send me messages connected to a video in my YouTube channel. Okay. So if we have no more questions, and I really appreciate you showing up, and I will see you next Tuesday on the Dr. Toomer Talk Show at 6 p.m. Eastern. Good night.